Chapter 16, December 23rd, 1918. After Thanksgiving, the days leading up to Christmas seemed less festive in 1918 than in preceding years. Although the number of influenza cases had declined, deaths from the disease were still occurring. The schools were opened again for the first week of December. Saturday classes had been added to make up some of the instruction time lost during the 7 weeks of closure. Even though the quarantine ordinance was relaxed by mid-December, partly at the behest of shop owners who had been seeing few people in their stores, the number of shoppers during the week before Christmas continued to be much smaller than had been anticipated. Many townspeople seemed to have become accustomed to avoiding places where more than 2 or 3 people might gather. Still, many residents of Rosebud County kept plans to celebrate Christmas, Hanukkah, and New Year's. The war had ended. No draftees had gone to military assignments since Armistice Day. Dr. Harvey stood beside Frances Olson outside Howard School to welcome students back to classes and greet those parents who had brought their children to school. She said, "Some parents won't allow their children to return to school yet, but as you can see, many have. Not all believe the danger is over." He responded, "The epidemic does not seem to be waning, and it does seem to be waning, and it is reasonable to allow children to be in school again. But the danger is not over. We still rely on parents to keep ill children home. If a student is ill at school, teachers must isolate them and make arrangements for them to go home. I hope it does not become necessary to close schools again." Francis replied, "I certainly hope not. Many business owners and parents were relieved when the ordinance was rescinded. I even heard Sheriff Starr say he was glad to have all his staff back again instead of quarantining, as he called it. I expect the county commissioners and the city aldermen will be happy to concentrate on other issues too," he said. "Not all business owners feel relieved, though. Saloon operators won't have much of a chance to resume their normal practices before the state prohibition laws close them down for good at the end of the year. Like jumping from the frying pan into the fire, I guess. For them, the dry new year may not be a happy one." She responded wryly, "Even when the saloons are closed, I expect liquor sales will not dry up entirely." He asked, Is enrollment at smaller schools in the country expected to be about the same as it was before October?" "I think it will be close to the same," she replied. "Some homesteader and rancher families have found places to live closer to town, so their older children will be nearer to schools." He observed, "It is no small sacrifice for families to arrange for their children to attend school." "Must be doubly challenging in the middle of winter," she noted. "Thank you for being here. I'll let you know the enrollment numbers after I receive attendance reports from all the schools later this week." On the morning of December 23rd, Dr. Harvey met the county commissioner on the sidewalk. "Good morning, doctor. I am on my way to the cafe. Would you join me for a cup of coffee?" "I would love to have some coffee to get the day started right." "That's great. Let's go get some." They sat at a table by the window of the cafe. Alice greeted them. "Gentlemen, good to see you this morning. Would you like some coffee?" Both said, "Yes, please." She filled 2 cups and placed a creamer and sugar bowl on the table. The 2 men sipped their coffee and sat back in their chairs. The commissioner spoke first. "Is this damned epidemic over? It has been a royal pain in the ass, a doozy of difficulty, for our country and the whole country. For our county and the whole country." Dr. Harvey responded, "For the whole world, this has been a pandemic, as big as epidemics get. It is not over, but at least around here it has slowed down. It might resurge, but if we are lucky, it will end soon." "Lucky?" the commissioner said. "Isn't there something besides luck we can use to fight this?" He replied, "Well, Commissioner, the measures and ordinance you passed probably helped slow the spread of the disease and save some lives. But the exact cause of influenza is determined, and maybe a vaccine developed. Maybe luck will remain an important ally." The commissioner asked, "Do I understand correctly the hospital activity at Masonic Lodge may be decommissioned soon?" He replied, "I think so, although I have mixed feelings about losing the availability of a hospital setting here. The Masonic Lodge space has been very helpful, and having nurses to provide inpatient care has certainly saved some lives. It would be best if Forsyth had a hospital. Still, the temporary setting at the Masonic Lodge will possibly end soon if influenza cases continue to decline." The commissioner said, "Commissioners have discussed this. Voters may agree to bonding to build a hospital, but I don't think the political will is firm enough yet to put this issue on a ballot." Dr. Harvey added, "Some wounded and disabled young men will be returning from military facilities. The problems they bring will require substantial care and support. For some of these men, availability of a hospital and nursing care may become the factor allowing them to stay in their hometowns or forcing them to relocate to cities with more capacity to support their needs. Good point, Doctor, the commissioner said. We supported our young men on the way to war, and we need to support them when they return. There is one other item I'd like you to consider, he mentioned. The nurses who have provided care at the emergency hospitals have all done an outstanding job. I think each would feel honored to receive a letter of commendation and thanks from the county commissioners. I would be happy to draft a letter if the commissioners would consider issuing such a commendation. The commissioner smiled, a rare display for him, and said, Indeed, please do. I am sure we will want to provide this recognition. While we are at it, we will want to document our thanks to the Masons, too. Dr. Harvey replied, Of course. The commissioner finished his coffee and placed the dollar on the table before standing to leave. He said, Thank you for the updates. I must go now. Dr. Harvey waited at the table for a moment, then saw Alice coming. He said, I have missed seeing you for a few months. I hope to come in regularly again now. Is the meatloaf still on the menu? We have missed seeing you too, Doctor. This disease has changed many things in our town. Do you think we'll ever get back to normal again? She asked. He opted not to pursue a discussion of normal. She continued, Yes, the meatloaf dish will be ready for you whenever you come. That's part of a normal we have not changed. He asked, Is the hamburger sandwich on the lunch menu? She responded, Yes, we are calling hamburgers again. Haven't heard anything about the Loyalty League lately, and don't really expect to hear more. Hope to see you at lunch, too. He said thanks. I'm looking forward to that. He put on his coat and gloves and left the cafe. When he arrived at his office, May was sitting at her desk in the entry. She said, Good morning. Did you freeze outside this morning? Almost to the bone, he replied. However, I just had coffee with the commissioner, and I've begun to thaw. How are you today? I feel fine, she said. I am blessed to be healthy and working. I have been thinking about my wish for the new year. Usually I wish for new and exciting experiences. But this year I'm hoping for 1919 to be less eventful and much less stressful than 1918. He responded, I hope you get your wish. Many others will have the same hope. May said, The first scheduled visit today is at 1:30, so you have some time to review a few messages from this morning. There is nothing urgent. Good, he said. I have wanted to talk with you about how you tracked down Jana Mueller's sister. You certainly helped the Mueller family to adapt, for now at least, to otherwise grim circumstances. May began to recall her search for the sister and said, Well, after Thanksgiving, when you told me of the difficulties Gerd was having, I began looking for a way to help. All we knew about the sister then was her married name and the county where she lived. I knew there was no Wells County in Montana. I called a friend who works at the State Library in Helena. She and I took some classes together at MSC before I married and came to Forsyth. Only 1 year of college for me, but my friend graduated and became a librarian. It was fun to talk with her again. Anyway, I asked her if she could find a Wells County in another state. She searched and called me back. She found 2 Wells counties, one in North Dakota and one in Indiana. She also asked if I might be looking for Weld County in Colorado. I told her I'd start with the Wells County and probably begin in North Dakota. She told me the county seat there is Fessenden, and even found a telephone number for the county auditor's office. When I called, a very friendly lady answered. I introduced myself and explained I was searching for Matilda Bauer, whose sister lives in our county in Montana. I told her I thought a woman with a German married name might not be too hard to locate. She laughed and said, You came to the right county to find German names. Almost everyone here is German, although there are a few Norwegians like me too. Then she asked how old Matilda Bauer was. I told her probably about 30 to 35 years of age. She said there are many Matildas and more than one Matilda Bauer in our county. I think you might be looking for Matilda Bauer, who lives up in Hamburg. She's about 35, maybe 40 years of age. The other Matilda Bauers I know of are older women or young girls. Then I asked if she knew whether or not this Matilda had a telephone. She said, I don't think so, but I could do a little checking and get back to you. I thanked her for what she was doing. I also mentioned that if she found Matilda Bauer has a sister, Jana Mueller, born Jana Lehman, then she might want to tell Matilda her sister Jana is alive, although she did lose her husband in October. Dr. Harvey is fascinated by May's tale of sleuthing. He said, You may have missed your calling. Many a Pinkerton would be envious of your detective work. Did the Wells County Auditor's Office get back to you? May, who was obviously enjoying the opportunity to share her adventure, responded, "Oh, yes, she called. I had called her on a Tuesday, and she called back on that Friday. Matilda Bauer does not have a telephone, but the lady from the auditor's office had driven to her home. I do believe the folks in North Dakota may be the most helpful people on earth." And sure enough, Matilda Bauer, near Hamburg, North Dakota, is the older sister of Jana Mueller, who came with her husband to Rosebud County, Montana. Dr. Harvey said, "I am aware Gerd, Miss Mueller, and the children went to the sister's home in North Dakota before Christmas. Were you involved in making that arrangement?" May replied, "Yes, I helped, and so did the lady at the Wells County's auditor's office. She arranged for Matilda Bauer to be at the auditor's office at the time Gerd called. I was told the entire conversation was in German and involved quite a mixture of tears and joy. Mrs. Mueller's sister invited the Mueller family to come for Christmas. Fessenden is on the Milwaukee road line, so the Mueller family took the train right from here to there." He marveled at how much May had done to help. He said, "Apparently Gerd has returned to Rosebud County to try to keep the Mueller ranch operating. She is a very brave young woman, but I'm not so sure she can succeed at this." May responded, "I would not count her out. She has developed an arrangement with a hired hand, a young man from a German homesteader family up by Ingomar. I guess his family has decided to return to Iowa, but he wants to stay. Whether or not Jana Mueller returns, Gerd wants to keep the ranch in the family, and she is trying to find a way to have her own sister and brother come from Germany to Rosebud County. Are you helping with that too?" May replied, "Yes. The more involved I become with the Mueller family, the more I want to do. It makes me feel good to help them." He said with admiration, "It's lucky for them you are here. Your dedication balances some of the unfair treatment they've experienced, although nothing can fully compensate their loss to the influenza epidemic. Let me also say that while folks in North Dakota have been very, very helpful, when it comes to looking for the most helpful person on earth, the search party won't need to look any further than where you are sitting." He continued, "Thank you for your work. I will review those messages now." However, he hesitated before going into the examination room. All morning he had a headache. It had become more painful, and now he was sure he also had a fever. He said to May, "I may be coming down with something myself. I've had a fever and headache. Would you try to contact the patients scheduled this afternoon and tomorrow morning and reschedule their visits until after Christmas? It might be best if I isolate myself the rest of the day and see if I develop a cough. I wouldn't want to spread anything to my patients." May appeared concerned by the idea that he might be ill. She knew he had worked very long hours every day since the epidemic had come into October. But the physician was not supposed to be vulnerable. She said, "Surely I will reschedule the appointments. Is there anything else I could do to help?" "I'll just go to my room and get some rest this afternoon," he replied. "I'm sure I will be feeling better tomorrow morning." She looked out the window. It had started to snow. "You should get your coat on and go now. I'll contact the patients and close the office this afternoon." He went into the examination room, picked up the messages from his desk, and donned his warm winter coat. When he walked by May's desk, he asked, "Do you remember when we talked after Armistice Day? You said something about a red horse supporting a pale horse. What did you mean?" He looked at his ever-curious and always helpful assistant. He replied, "I do remember. We have seen the red horse and also a white horse. The sword and pestilence are affecting more than a fourth of the earth. The pale horse has been busy." He took a piece of paper from her desk, wrote something on it, and handed it to her. And then he said, "When you are home tonight, read this." May looked at him and at the paper. "These are Bible verses." "Yes," he says as he stepped out the door. In his room at the Alexander Hotel Annex, he looked at the bottle of Flying U whiskey, but a drink did not appeal to him. He wanted to think as clearly as possible. He thought his headache and fever would probably resolve once he had a good night of sleep. As long as he did not develop a cough or upper respiratory congestion, he would return to his office to see patients right after Christmas. He thought of preparing a letter to request information about admission to the public health program at Yale University. He had listed some of the questions he would ask. The letter would go to a CEA Winslow at the Department of Public Health, Yale School of Medicine, New Haven, Connecticut. But he needed to get some rest now. He would prepare the letter tomorrow. Before he went to bed, he read the verses in the Bible he had cited to May, Revelations chapter 6, verse 2, 4, and 8. He also looked at the cover of a novel sent to him by a friend from medical school. His friend had recently returned to Chicago from France, where he had served in the Army Medical Corps at the military hospital, caring for wounded and ill soldiers. The novel by a Spanish author, Epidemics, has been translated to English, The Four Horsemen of the Apocalypse. His friend had included a handwritten note in the book. See what Chernoff says at the end of part 1. While I was in Europe, I saw all this. Pestilence, war, famine, and death. Dr. Harvey thought, I have seen much of this too. While the black horse of famine has not come to Rosebud County, an epidemic of suspicion has been added to the pestilence of war of our time. Could pestilence and epidemics such as these be prevented, or at least better controlled? He went to bed and soon fell asleep. He woke to the familiar knock, 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 and the voice of the hotel owner's son. Dr. Harvey, are you there? Then silence. Dr. Harvey could not move or speak. He could not open his eyes. Later he heard knock, knock, knock again, and the door opening. The voice this time was the hotel owner's. Dr. Harvey, are you all right?